conversation started. In framing the agenda for today's conference, the advisory panel and our team really recognized that equity needed to be a key component and a key ingredient to essentially every conversation we will have today. And we tried to figure out how best to represent that. And so we thought, you know what? It's just really important that we begin with a direct review of this topic and go through it specifically and then weave it into the rest of our day. So we will start off. We've asked Karen McNeil Miller, President of the Colorado Health Foundation, and Jim Garcia, CEO of the Tepeyac Community Health Center, to really set the stage for us, to bring their perspectives on the progress and the gaps in equity agenda in Colorado. And I want to turn it over first to you, Karen.
Thank you. Good morning, everyone. That was pretty tepid. Good morning, everyone. Good morning. All right. Got to get it going in here. So thank you for the invitation and a topic that I enjoy talking about, and it's part and parcel of the work of the Colorado Health Foundation. I hope many of you already know about the foundation, but in case you don't, we are a statewide philanthropic partner, and we seek out, support, and invest in solutions that help communities be able to say, we have everything we need to be healthy. And those things are self-determined by the communities. We have an agenda. I'll share some of what our agenda is. But part and parcel to what we are, everything we do is in trying to create health equity, trying to create conditions, help communities create conditions where everybody's got a fair shot at winning. And that having a state of equity isn't just an absence of inequity. And it's not just the absence of inequitable systems, but also the presence of equitable systems. And even though this conversation this morning is starting with this frame of equity, your entire agenda today is an equity agenda. Equity can frame every conversation that you will be having today. So everything we do is to create health equity. We exist to serve communities who live with low income, who have been historically marginalized, been without power and privilege, and we prioritize communities of color. And so I'm going to stop there because the question always is, why are you focusing on communities of color? Why are you focusing on race? There are so many other areas of health inequity. There's the rural-urban divide in health equity. There's inequity in women and children. There's inequity in the LGBTQ health community. And my answer to that is yes. And if you're data-based, you don't have to look very hard or very long before you discover where are the greatest inequities. Where are the greatest health inequities amongst people of color? Where are the greatest inequities in urban settings and rural settings? People of color. Where are the greatest inequities, the worst health outcomes for women and children? Women and children of color. Where are the worst health outcomes and the greatest inequities in the LGBTQ community? LGBTQ of color. So there is this centrality of race that regardless of what slice of a community you want to take, you just have to do a very surface level data. You just have to go down one level and you find that the greatest inequities, the worst health outcomes are amongst people of color. That is why we prioritize communities of color. And then we do everything with being informed by our community. Those of you know us, you know it's not just grant making, but we have convening, capacity building, our advocacy and policy agenda. We certainly believe that there should be health in every policy, and there should be equity in every policy. And not just in the health care system, we take a much broader view of health to include some of the social determinants of health. The areas where we want to try to have impact, where we see some of the big issues across the state, are in trying to shift power. And we try to do that with advocacy and capacity building. I won't read this to you. But where our clinical work comes in, where our health care focus is in access to primary care, integrated primary care, that Jim is an example of, that Tepeyac's an example of, and I know you'll hear a lot more about that. But we also have a heavy focus on those social and environmental determinants. Because by the time they show up in your medical clinic, by the time they show up in your behavioral health clinic, by the time they show up in your dental clinic, you're just seeing the symptoms of something else. You're seeing the result of another set of trials and tribulations that perhaps, and most often through no fault of their own, that they find themselves in. And that's the work that we want to do. So we center equity and justice in our work. We talk about having health equity through racial justice. And this is an internal framework that's not proprietary, and we're happy we share it with people. It's just not something we, publish. But this is our framework, and where the levers we think as a foundation that we can have impact in the equity DEI space. This is our external agenda, but there's also an internal agenda. And part of the internal agenda, and what I imagine you all wrestle with as well, is the mindset shift that takes you from there's all the work and equity work to equity is the work. That's a huge mindset shift. It took us about 3 years to get there, because people were talking about, I've got so much work to do, and then I've got to go think about equity and justice. It's like, well, both of those things are true, but they're all the same thing. And so we have worked very hard to have this framework and have that mindset show up in everything, so that in all of our discussions, whether it's about our vendor engagement, whether it's about who our bank is with, where our funds are held, whether it's who we hire as a caterer, the conversation has to center around what decision can we make that would help advance our equity agenda? What does that decision look like? And so you have to bake it into the DNA internally before you can adequately manifest it well and believably externally. And on the external side, it doesn't work if you have the fake it till you make it motto. Because while you might be able to fool your coworkers, you can't fool community. They will have your number very quickly. So you have to be earnest about it. And if you're going to have a DEI equity agenda, you have to be serious about it. There's been an entrenchment recently with didn't we do that equity thing already? Because if you remember, after George Floyd was murdered, every corporate organization, almost every nonprofit, I'm sure your organizations came out with statements of support and commitments to DEI, to equity, to justice, to racial justice, to being anti-racist. And now, 2 years later, you see you don't see that energy anymore. And an organization that I used to be associated with as an employee, the Center for Creative Leadership, which is based in North Carolina but has an office in Colorado, they looked at they just did the Fortune 200. They looked at the Fortune 200 companies and looked at all the promises they made after the racial reckoning, George Floyd's murder in 2020. And now, 2 years, 3 years later, they went back. And fewer than 10% of those companies are showing any demonstrable effort to even live up to those commitments. And fewer than 2% are showing any demonstrable results. So my question to the nonprofit community, to the government community, would be, what if they did that study about just the statements the organizations in this room made? Would they find the results to be any different? And I think that's something we have to ask ourselves. So we have worked hard on this inside the foundation. We also discovered that we needed to have some public accountabilities, because people would ask us, well, how do we know you're serious about it? You say you're serious, but where's the proof? Show us the proof. So we did come up with some public accountabilities. We made accountabilities or commitments on our new funding from 2021, that at least 50% of our funding would go to organizations that served at least 50% people of color. And back to the why are you focusing on race, the second question that comes after that is, so does that mean you've forgotten about poor white folks? No, it does not. This is an example of that. If we're putting 50% of our funds to organizations that are serving 50% people of color, where are the other 50% of the funds going? So that just demonstrates that it's not to the exclusion of low-income white communities. Another commitment of ours is that our capacity building funding for the next few years would be heavily focused on organizations that are BIPOC-led, BIPOC serving, and accountable to BIPOC communities. And we publish these on our website, so you can see our 2021 and 2022 data. We made a commitment about our total funding. And for those of you that know Foundation World, we are required to distribute 5% of our assets on an annual basis. And for us, that's about 155 million. But then there's that other 95%, our corpus. And so we made a commitment that by 2025, at least 25% of our corpus, which is now at about 2.7 billion, would be managed by firms owned by women or people of color, or who had women or people of color in significant leadership positions. Our 2023 data will be coming out soon. We're already at 28%. So we've already exceeded that goal of 25% by 2025. And so the reward our investment team gets for beating the goal is a new goal of 40% by 2025. So, that's another example of our commitment. Our commitment that our board would be highly diverse, and a commitment that our staff would be highly diverse. So I will stop there, but just again to say that so many policy decisions made by well-meaning people, if not done with an equity lens, if not done with an equity mindset, often lead to disproportionate negative impact on the very people who need that policy and may benefit that policy the most. And that's the reason to have an equity lens in the rest of your agenda and in all of your agenda as you go forward in your work and in policy change. So I'll stop there.
Thank you so much. And we will take questions at the end as well. So I'm going to turn it over to you, Jim. Pass that over to you so you can manage your slides. And you absolutely, we can. Here you go, sir.
So I'm clear to my. Okay, got it. Good morning, everyone. So Tepeyac Community Health Center, we started nearly 30 years ago, and it was during a time when the idea of diversity, equity, inclusion just really obviously wasn't mainstream at all. It was what didn't come until much, much later, but it started with a community, and it just evolved very much as an organic grassroots movement. It was a community in North Denver that had very limited resources, and it was a community that was very focused, though, on, it was actually a church community, Our Lady of Guadalupe Church, which at the time was a hub of activity for the Latino community in Denver. And at the time, it was, the community was experiencing just this tremendous need when it came to access, basic access to health care. And it manifested in a way that in the church office, people were coming to the church office asking for help with basic health care, basic dental care, in many cases, help with mental health. And the church had nothing to offer. But what we did have at the time, as you can see in the photos, was an old North Denver bungalow that was about 800 square feet. And we have a kind of a basic timeline of when we started. We started with this little rundown 800 square foot house. We had no budget to speak of, and so the community came together and said, this is important to us. The issues of basic access to health care was important. So the community came together, put forth their sweat equity, and converted that, what you see in the first picture of a rundown house, to really a beautiful little 2-exam room clinic that we opened in 1995. I'm not going to go through all of the timelines, but you can see it's been a progression of growth for Tepeyac Community Health Center. Within a matter of the first year, we outgrew the house, but we had limited resources again, so it took us some time before we made the decision to move to the Gloveville neighborhood. That's part of the Gloveville, Elyria, Swansea neighborhood. When we moved into the Gloveville neighborhood, it was by design, by intention, and it just so happened that Gloveville was just experiencing significant environmental justice issues. When we moved into our Gloveville location, the community had just experienced environmental mitigation. That zip code that we live in, 80216, was the most polluted zip code in the country. And so we felt, what a better place for Tepeyac to put down a stake in the community, and that's what we did in the Gloveville community in about 5 years after we relocated from our original little renovated house. And so from the point that we moved to the Gloveville community, we thought this is going to be our permanent home. We moved into a 6,000 square foot facility, 10 exam rooms. We thought, well, we're in a palatial facility compared to where we came from. But we found out again within a few years that the need was just continue to grow, and we thought, okay, now as an organization, as leadership, we need to be thinking about what our community is needing. And so we started planning, our board started planning based on input from our community, what our next move was going to be. And one of the pivotal points in our timeline was when Tepeyac became a federally qualified health center about 7 years ago. And it was at that point that we were able to realize the whole concept of the full integration of care of medical, behavioral health, dental, but we were doing it on a very limited basis based on the limited space that we had in our Gloveville facility. So once again, we took, the community said, okay, this is what we need. We need better access not only to medical care, but also dental care and expanded mental health care, pharmacy. And so we knew that that was not going to be possible with what we had in our 6,000 square foot facility in Gloveville. So again, in partnership with our community and with our leadership, said, okay, what's going to be our next move for Tepeyac? And it was, at the time, this was about 5 years ago, we were approached by the Urban Land Conservancy and said, we have acquired this 6-acre parcel right in the heart of the Gloveville, Elyria, Swansea neighborhood, and we would like Tepeyac to be the anchor organization for this project. And what was exciting for us in a leadership position was we were excited about being able to greatly expand our services, but with this opportunity, we were able to partner with other organizations to offer affordable housing and access to fresh food. For those of you that are familiar with the GES community, you know that access to affordable housing, access to fresh food is a critical need. So when you think about the social determinants of health and what that means for a community, it made perfect sense for us to have the opportunity to expand our services while at the same time being part of this larger effort to expand services. So what you see here, the planning for our current facility, which we opened back in February, is a close to a 25,000 square foot facility with affordable housing above, and this coming year in 2024, there will be a fresh food market that will be opening up as part of this effort. So again, it was having that vision that the community had for what was needed. It wasn't just, we knew that we needed expanded access to integrated health care, but we also knew that there was also critical needs that the community was saying that were not being met as it related to affordable housing and access to fresh food. So with this effort, we were able to address those issues. And again, we opened up our current facility that's located in the Elyria neighborhood that has allowed us to greatly expand our medical services. We went from one dental operatory to a dental suite of 6 operatories. We went from not having any dedicated behavioral health therapy rooms to having a dedicated behavioral health suite with 7 behavioral health rooms with capacity for our 7 bilingual behavioral health providers. So when you think about, again, the community, our patients, our community, I think to Karen's point, when you look at the Glowville, Elyria, Swansea neighborhood, the 80216 zip code, this for generations has been a community of Denver that has been largely overlooked. It started as at the turn of the century, it was a community that welcomed immigrants, and these are immigrants that came from Eastern Europe, and they came because of the employment in the smelting plants and the meatpacking plants. Which created opportunity, but it created a legacy of environmental degradation that the community has experienced over the past several decades. And so I think that is an issue that as a organization, as a healthcare organization, we've made it a point to be part of that larger conversation with the community in terms of addressing issues around environmental justice, as well as all of the social determinants of health that our community is facing. There are numerous challenges that our community continues to experience, but I think what we prefer to focus on are the strengths and assets of our community. We all know about issues that are facing communities of color, especially immigrant communities, in terms of language access and just culturally responsive care and just access to basic services. But I think from our perspective, it's about what are the strengths of our community that we can continue to leverage in terms of the assets that our community brings. And I'm not able to read any of this, so you'll have to bear with me here. So we're looking at as we opened up our facility in February of this year. We already have doubled our capacity in our current facility. We feel like we're going to be able to eventually triple and quadruple the capacity of what we were able to serve in our previous location. So I think that is what our community has asked for. That is what I believe, as a community, as a leadership that incorporates the community voice. This is what we're focused on at Tepeyac Community Health Center. I think with that, I'm going to close with a video by, or a spoken word video by Bobby Lefebvre, who's a Colorado Poet Laureate, who I think expresses the sense of optimism that our community is feeling when it comes to access to health care and access to the services that our community wants and deserves. I do want to say, when it comes to the funding community, I think there's, with the leadership of people like Karen and the Colorado Health Foundation, that paradigm has undergone a complete shift, I would say, in terms of the philanthropic community and how they're approaching the issues of diversity, equity, inclusion. And I will share, and I don't, Karen, if you remember this story, but when we were planning for our new facility, it was a major lift. This was a $15 million capital campaign for our new facility. So I was meeting with all of our friends in the philanthropic community, and had set up a meeting with Karen and gave her my pitch in terms of what we had envisioned as a community and what we were planning for, and that was going to include the affordable housing component, the fresh food component. And I went into the meeting with Karen thinking, well, this is going to be a big ask. I'm kind of nervous about this and not sure what kind of reaction I'm going to get. And after I made my pitch, Karen said something like, Jim, I don't think you've asked for enough here. But I think that is really the shift that I think that is taking place now within the philanthropic community. It's been a slow change, but I think with leadership from people like Karen and the Colorado Health Foundation, that shift is happening, and I think the other foundations and members of the philanthropic community are getting on board with that mindset of working with community and working to bring about the change that the communities and the people and the families that they're asking for. So with that, I'm gonna I don't know if I triggered here. Just to give you a little bit of context, Bobby has been a friend of Tepeyac for many years, and where he's reciting his spoken word is actually in the foundation of our new health center before we started the build out, so that gives you some context.
We find ourselves here, together on native land eternal, on the cusp, at a juncture, at a portal to new things. We stand in the spirit of the ancestors, on the shoulders and sweat of yesterday, seeing through the eager eyes of tomorrow. Tomorrow, a beacon beckoning us. Tepeyac, a call to serve, a rally cry for action, a mobilization of unwavering minds. For what is community but the people? The people, a circle forming, a chorus sounding, a bridge stretching. What is community but a heart expanding? A hand extending, an embrace encompassing. This sacred earth beneath our feet, esta tierra, this dirt, this hope, this promise, a foundation, an anchor, a compass pointing in the direction of prosperity. They said it was impossible to move mountains, so we created new landscapes. They introduced us to glass ceilings, so we reminded them of the freedom of an infinite sky. They tried to render us voiceless, así que ahora cantamos canciones de supervivencia. We know that boundaries are nothing more than invitations for exploration, a starting line from which we sprint in the direction of the uncharted, a catapult that launches us in the direction of the fruition of our dreams. Come and build a home with us, from the ground up, brick by brick, story by story, from root to fruit, here where care is comprehensive and culture is a cornerstone and compassion is king. Aquí estamos y no nos vamos. Tepeyac is a wave growing, a force conspiring, a rose blooming, the sun rising to warm. Join us in this forward-facing future where no need is left unmet and thriving is a pillar of progress. Join us in this transformation, in this celebration of excellence, in this journey that has only just begun. Help us construct a home, a soul we sit inside of, a gathering place that uplifts what others refuse. a door that opens for all, and it is here that we will live, dignified, human, and healthy, integrity and ingenuity leading the way.
Thank you both so much for these opening comments, exactly what we were hoping for, and I hope you all use these offerings. Jim, your point about not just talking about the challenges, but the assets of a community is really key, and I think that that's part of what I hope folks incorporate. And your point about progress made, but lots left to do in maintaining that commitment. I want to ask just one question of each of you, and then I think we're gonna wrap here. The question is really, is there something you want people thinking about as we go into these sessions the rest of the day? Is there something you want them to remind them of or carry into those conversations that would be helpful to them?
Well, I can start. I think about Karen's comment earlier about this. It seems like the topic of diversity, equity, inclusion is something that we all hear about. It's become part of the lexicon. It's become part of just the topic of conversation that we all have, especially in the nonprofit community, and we hear about it being a priority within the corporate community and within the philanthropic community. But I think my concern is that there may be a sense of complacency that tends to settle in when there's not a certain level of activism, I think, that is necessary. And so I would say just the importance of the community voice when it comes to appreciating and always be willing to think beyond just what the standard expectation or the definition of DEI, but what does it mean in real terms to our communities and to the families that live in these communities? And so, I just encourage everyone to think in those terms, to think beyond what you may think you understand to be the issue of diversity, equity, and inclusion.
I echo that, Jim. And again, as I said earlier, your whole agenda is an equity agenda. And I just ask that you keep that in mind. So you've got a retention and workforce challenge. Who's it been hardest for you to hire? Behavioral health transformation. In what communities is there the greatest stigma? Drugs and policy. To whom is it are drugs the least accessible and the most expensive? That may cause them to be non-compliant in their instructions of taking medicine. So if you ask different questions, ask questions that data will support, it will get you to an answer of where there is outsized, disproportionate negative impact on particular communities, particular segments. And then that is an equity, and that is an equity conversation.
Thank you both. Please join me in thanking our panelists today.